The Ghana Health Service has stepped up public education on the safety of the COVID-19 vaccines expected to arrive in the country this week. The Ghana Health Service has confirmed it will take delivery of more than 500,000 vaccines for the inoculation. So far, the Oxford-made AstraZeneca and Russian-made Sputnik V vaccines have been approved for the inoculations here in Ghana. And even though the Ghana Health Service has been assuring of the safety of these jabs for use in the country, Ghanaians are divided on whether or not to receive them. We'll hear shortly some of the things that you've been telling us. But first, listen to the Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu-Bequin, giving details on these vaccines earlier on the Super Morning Show.
So, Ghana has signed the indemnity clause for the COVAX facility. If you look at the Sputnik, it is not part of the COVAX facility. So Ghana is yet to sign that agreement with the present government. Apparently, if you look at the ministry or the president, he wants us to be dealing directly with the source. So in terms of like AstraZeneca, we actually signed a contract with the Serum Institute of India. So for Sputnik 5 or B, as you talked about, we are yet to get that arrangement done. As I said, we had the signing or the approval done a few days ago, and the government is going to engage the Russian government in that perspective. But as was said by Miao, we are not limiting ourselves to particular vaccines. If you want 40 million doses, then you need to up your game, either treat more cold rooms or making sure that you get available vaccines. So we are not restricted in terms of the kind of vaccine. So far as the state, the cost is not an issue for us to get the 40 million doses.
Are there any hidden advantages of the fact that on this occasion we are buying from a nation rather than a pharmaceutical company in terms of price and perhaps even diplomatic arrangements to get more or get them quicker? Are those options available to us?
Well, I think that if you look at the Sputnik 5 or V, it's from the Gamaleya Research Institute, which is under the Ministry of Health. So it's directly a government entity. The other products are private oriented. So I don't think it's much of a difference. The issue is we are trying to go to the source of production so that I have that government to source arrangement. So that is the issue. In terms of the cost, I think that the Sputnik V appears more expensive than AstraZeneca. Yeah. I think it's more than about $10 per dose, whereby the AstraZeneca is about $4 per dose.
Yeah. So how much are we buying and when is it arriving?
I think that there's an initial agreement of about 10 million doses. We are yet to come to when it's coming. There are a bit of, illegal issues to go around it, and then we can be certain when to get it in the country. So
we don't know when as yet?
What I can talk about is the AstraZeneca. The initial ones will come this week. But for this Sputnik, I don't have a lot of information about when it's coming. All I know is that Ghana has been earmarked 10 million doses.
Well, the country is expected to leverage existing immunization infrastructure with the aim of inoculating an initial 20 million of us. Here's Program Manager at the Enhanced Program of Immunization at the Ghana Health Service, Dr. Kwame Amponsa Achiano, who says the country has activated a chain of cold storage facilities across the country for this exercise.
We have a robust system. We have cold chain facilities from national, where we have the national cold room, regional cold rooms, district cold stores, and if you've been around for quite a time, you see that during campaigns, vaccinators and volunteers carry a special bag around their shoulders. It's called a vaccine carrier. Within that carrier, you have what we call conditioned ice packs. which would also maintain the cold chain. But then at the office, in the office where the vaccines are stored or stored in bulk, we monitor the temperature using an electronic type of temperature called the fridge tag. So we have experience in that, and normally when we train vaccinators, we take them through maintenance of cold chain and also. Yeah, there's also what we call the VVM, vaccine viral monitor, which is a small patch that is heat sensitive. And so once it crosses it changes to a certain color. Again, they are trained to recognize whether to use or not to use.
Well, across the world, the infections and deaths have been slowing. Head of our health desk, Fred Smith, is joining me via Zoom with some details. Fred, first, what's Ghana's situation?
Well, Ghana's situation appears to also be slowing quite a bit. The new cases we have for the 18th of February, that's the latest we have so far. It's 598 cases, bringing our active cases to 6,658 in total. Confirmed cases have now crossed 80,000. We're now at 80,253. The recoveries are 73,018 so far, and we have 577 persons also dying out of this disease so far. And if you check in the last few days, we are getting cases around 500, 550 thereabouts. That wasn't the situation in the middle of January when we're getting 700 and sometimes something close to 800 cases. And that's how Ghana's situation is like at the moment.
Well, take us through a bit of the global situation. What is the global situation? And then from there, we can perhaps talk also about the vaccination processes over there.
Well, generally, there appears to be a decline or a slowing of the infection across the world. And according to the WHO website, the dashboard provided by the Global Health Body, some of the majority of the countries that were battered by this virus are now recovering. Even though that's very slow, they still are recovering. And so if you check the middle of January, where the cases were so high, we're now seeing a situation as at the 20th of February, when the cases appears to be dropping significantly. But this will have to continue over a certain period of time for us to say that it is the vaccine or the vaccination that's going on, which is helping in slowing the infections. But generally, good news, even though we still are in this situation, there seems to be a slowing of the spread of the virus.
And now it's interesting that you mentioned the vaccination, because I was just going to ask if there is any clear evidence of anything at all that the vaccine may have had with the slowing in this process.
Well, that's not so clear yet, but that's what many believe is contributing to it. We need the scientific evidence of this, and so it's the reason we need to wait for some time to be able to establish that this is the reason. Of course, that's what we all expect, that the vaccine will help in reducing the spread.
Sure. Fred, thank you very much. Fred Smith is head of our health desk here at JoyNews. Now, the public is divided over whether or not to receive the jabs when they arrive. We put up a post earlier on our social media handles. Let's take a few of your responses here. So we're starting with Facebook. And so that's the post that we put out there. Let's take a look at the response. Buyer Jeremiah says, yes, I'm ever ready, and any day, anytime. Ghana has good track record when it comes to vaccination and immunization. I'm ready to be the first person to receive the vaccines, even live in the public. This one too shall pass. He says, Emmanuel Muinana says, I just sit down, not suffering from COVID, not recovered from it. Then I just got up and go for AstraZeneca. As what? Food? Okay, it's not drug. Is it not drug abuse? Is it the vaccine? Is the vaccine not the treatment? Vaccine or is it preventive one? I think procuring the vaccine is good, though, but who should be vaccinated should be seriously looked at. Well, Emmanuel, the point is that it helps you. It's a protection. It's more of a preventative measure. Come David said, some Ghanaians and their evil thoughts and shallow minds, you should have been taking the white man's vaccine all this while. Okay, so you are trying to make a case and you're talking to Emmanuel there. Nana Yawamponsa says they should just publish the line to call for protocol. And Frank Camille says, I don't believe and trust our politicians. Before I allow my family to be vaccinated, I want to see the president down to the least being vaccinated in public. Dede Gerard says, no, I am not ready to take any vaccine. If this vaccine is effective, why is it that so many European countries are still indoors and suspend people from going to public gathering and not living their normal life? So those are some thoughts, responses from you as to whether or not you go for the vaccination.